Welcome to Effects of Massage on the Integumentary System. We do have a Word document that goes along with this video. I am going to share the screen in a moment, but I wanted to let you know that the effects of massage are not in your textbook, your physiology textbook. They are, however, in your massage mastery textbook, and they begin on page 82. So all the effects of massage that we're going to talk about are in your massage mastery textbook. I will try to give you specific page numbers as we go along. For now, I'm going to share the screen, and we have effects of massage on the integumentary system. So the first thing that I want to mention is that massage has roughly two different types of effects. You have mechanical effects, which are physical things that occur to the body as you're massaging it. So direct manipulation of the client's tissue is a mechanical type of massage and has mechanical effects. And then you have reflexive. Reflexive typically involves the nervous system and the effects of massage on the nervous system. So I'm going to try to go through these and tell you, which ones are mechanical and which ones are reflexive as we go through the effects of massage on all of the systems, not just the integumentary system. I bring that up for a couple of reasons. First of all, it is on the MBLEX. It is a piece of information that you should know. And also because not all effects of massage on a body are the same. And they do very, very different things, whether they're mechanical or reflexive. All right, so let's start with number one. Massage desquamates or exfoliates the skin cells. So of course, as you are rubbing over the skin, you are going to be taking off some of the dead skin cells on the epidermis. Now, do you think that's a mechanical or a reflexive effect? Yes, that's correct. It is a mechanical effect of massage. You're physically doing something to the tissue, right? It's kind of gross to think about you exfoliating someone else, but in a regular massage with oil or lotion, you're doing a fair bit of exfoliating. And then, of course, if you work in a spa setting and you're using a salt scrub or a sugar scrub, well, that's the point, is exfoliation. So you're going to be doing a lot more of that. All right, number two, massage stimulates, sebaceous glands. Stimulation of the sebaceous glands improves softness, suppleness, and elasticity of the skin. Yes, so anytime you rub over the skin, you are stimulating the oil glands to produce more oil on their own. But then, of course, you are also adding lubricants and unguents. In my practice, I only use oil. I don't use lotion or cream. So the oil that I use actually soaks into their skin and improves softness and suppleness of the skin. Now, massage stimulating sebaceous glands. Do you think that is a reflexive or a mechanical effect? Yes, it is another mechanical effect. As you are squishing the skin and rubbing over the skin, the sebaceous glands are releasing more oil in response to movement of the hair, essentially. All right, number three, massage increases scar tissue mobility. Cross-fiber friction and other scar tissue techniques applied during the remodeling phase of scar tissue healing ensures the proper alignment of collagen fibers, which leads to a more mobile scar. Yes, we talked about this when we were talking about tissue repair. So really at any time in the life of a scar, you can apply massage therapy and it will still help. But during certain times, like during the remodeling phase, if you apply specific scar tissue technique to that area, it can actually help the collagen fibers lay down more nicely instead of all haphazardly, and can create a more mobile scar. you will have to take separate continuing ed in scar tissue management and scar tissue treatment in order to be able to apply those techniques. This is not something we teach in a foundation program. But I do this work myself, and I must say that it really does have profound effects. So I would highly encourage you to go on and take some scar tissue classes once you're finished here. That's mechanical effect, by the way. Number 4, massage increases local circulation, bringing fresh nutrients and oxygen to the tissue and aiding in removal of waste products. Yes, absolutely. The number 1 effect of massage on the human body is increased circulation, locally and systemically. So we're really just talking about local circulation. As you rub an area, it gets red, right? I mean, if you have siblings, you remember the Dutch rubs they would give you in retaliation for something you did to them, and how red it got. You know, the skin itself has a lot of blood vessels, a lot of capillaries, just not in the epidermis, right? It's in the dermis. And as you rub that area over and over again, the capillaries open up, more blood and oxygen comes to that area, and in addition, wastes are removed. And when I say wastes, I mean tissue wastes. Remember, cells are constantly undergoing processes within them that are going to produce tissue waste, and that tissue waste is going to be expelled by the lysosomes, remember? So your bloodstream is ultimately going to pick that waste up, and then it's going to get filtered out of your body. Excuse me. So massage increases local circulation. Let's see, massage lubricates the skin. Absolutely. That kind of goes with number 2 a little bit. The lubricants used are going to soak into the skin and are good for the skin. They're specifically designed to be used on skin. They are designed not to soak in right away, however, so you can use them and work that body area, but once you're done, they soak in quite nicely. And like I said, I use oil exclusively, and that works very, very well for almost all skin types, and especially for people with a lot of hair, people who have maybe hair around their chest and neck, or hair on their back, or a lot of hair on their arms. The oil works quite nicely for that, so I don't accidentally pull hair. Lubricants also aid the barrier function of the skin. So remember, we talked about the acid mantle that's already there. Well, if you add lubricants like massage lotions and oils, that creates an additional barrier to prevent any kind of pathogen from entering. Okay, so those are all mechanical effects, actually. Now, in addition to the above mechanical effects, see, I told you, massage has a profound effect on the central nervous system by stimulating the parasympathetic response, which initiates the relaxation response. We will be talking about this quite a bit throughout the course, but let me just introduce to you the concept of the parasympathetic response. Ultimately, your nervous system is set up in 2 ways, sympathetic and parasympathetic. Sympathetic is more fight or flight, you know, it makes you ready for action, you're awake and alert and aware. Parasympathetic is the opposite of that. This is more rest and digest, shutting down all non-essential functions, healing, and that sort of thing. So when somebody receives a massage, what you, the massage therapist, are doing is you're touching them all over on their skin. There are nerve fibers in the skin, as you saw in that picture of the dermis, right? You had a couple of different nerve fibers. You had some that looked like discs, you had some that looked like little branches. They're different nerve fibers, but the point is that there are a lot of them in the skin, which I had mentioned. And as you are touching those, you are sending a signal to the brain via the skin, and the brain is trying to process all of that information at the same time, and it doesn't like to do that. So what it does is it downshifts out of sympathetic nervous system and into parasympathetic nervous system. So your body, just from being touched goes into the healing and the resting and the relaxation response. I will go into more detail later when we get to the nervous system and things like that. It'll make more sense, but that's your introduction for right now, okay? Therapeutic touch puts an individual into parasympathetic dominance, the rest, digest, and healing, okay? All right, so what did we learn here today? We learned the difference between mechanical and reflexive effects of massage. We learned all of the mechanical effects of massage on the integumentary system, which most of them are. And then we briefly discussed one reflexive effect of massage on the integumentary system. Okay, there will be some questions on the quiz about this, so make sure that you take a few minutes to study this material before the quiz. I'm going to stop sharing the screen. And that is all for now.